This is the case of detransposition of great arteries. This is parasternal long axis view, and you can see in this image left atrium, left ventricle, then pulmonary artery from left ventricle, right ventricle, and aorta coming out of right ventricle. So parasternal long axis view, just take the teacher's mode. This is left ventricle, this is right ventricle. Right ventricle is most anterior structure. This is anterior one, this is posterior one. So this right ventricle is most anterior one, and from there aorta is coming. Left ventricle is compared to right ventricle is posterior, from there pulmonary artery is coming. You can see both aorta and pulmonary artery is seen in the same image in long axis, so ultimately indicating transposition of great arteries. Since there is AV concordance and only BA discordance, this case comes to be detransposition of great arteries. From LV pulmonary artery, from RV aorta. So initial part of pulmonary artery and aorta both are parallel. You see, this is the initial part, this is the initial part. You can see both initial part is parallel. So what happens in the case of detransposition? This is horizontal line. So whenever great artery comes out of left ventricle, if it is aorta, then it would go anteriorly. This is go anteriorly. This is normal direction of aorta. If it is the case of normal presentation, then aorta would start like this. So when aorta starts from left ventricle, it goes anteriorly. But when there is detransposition and pulmonary artery is arising from left ventricle, then it will go posteriorly. So it goes posteriorly. See, this is posteriorly. So whenever the artery that is arising out of left ventricle and going posteriorly, in a state of ventricle it goes posteriorly, that means it is the case of detranspose. It is the pulmonary artery that is coming out of left ventricle. So this case becomes detransposition of great artery. That is the point that you have to know in case of parasternal long axis view, in case of detransposition of great arteries. So see, this is the image, this is a moving image. Can you see? At the same time, you can see the aorta is bigger one compared to pulmonary artery. This is aorta, this is bigger one, this is pulmonary artery. So pulmonary artery is smaller compared to aorta, because aorta goes more anterior compared to anterior and superior compared to pulmonary artery. So this is the next image, same thing. This is parasternal long axis view, left ventricle to pulmonary artery, right ventricle to aorta. Again the same thing, parasternal long axis view, right ventricle to aorta, left ventricle to pulmonary. This is short axis view. You can see the D-shaped left ventricle. This is D-shaped left ventricle. You can see D-shaped left ventricle indicating raised right ventricle systolic pressure. This is color flow. This is apical 4-chamber view. You can see the right atrium, right ventricle is dilated compared to left ventricle. Now you see the position of aorta is anterior and slightly right compared to pulmonary artery. So always the position of aorta is described in comparison to pulmonary artery. So aorta is anterior and right, because aorta is coming out of right ventricle, so it is coming from right side. At the same time anterior, because our right ventricle is more anterior compared to left ventricle. So aorta is coming from right ventricle, it means it has to be right and anterior. Same thing. This is aorta and this is pulmonary artery. Aorta is, this portion is right, this is left. So aorta is anterior and right compared to pulmonary artery, because right ventricle is in the right and anterior to left ventricle. So aorta is also having the same relation with the pulmonary artery, because aorta is coming out of right ventricle, so it has to be in the right and the anterior, because right ventricle is anterior to compare to left ventricle. Again, this is 4 chamber view, clearly indicating right atrium, right ventricle dilated compared to left atrium and left ventricle. This is the right ventricle and aorta, how aorta is coming out of right ventricle. Then is apical chamber, apical view. This is the supraesternal long axis view, because the long axis of the aorta is seen in this image. You can see the aorta, there is no flow obstruction, no coarctation. You can see in this image the inferior vena cava. This is inferior vena cava, this is IVC, and this is aorta. This is aorta and this is IVC. So IVC is in yellow, aorta is red. So IVC is in the, this is right, this is left, this is anterior. So IVC is in the anterior to aorta, at the same time right also. So there is situs, serratus and normal relationship of IVC in aorta. IVC size wise dilated compared to aorta, so IVC is dilated in this case. You can see this is left ventricle, this is left ventricle, this is right ventricle, this is apical view, and this is pulmonary artery, because it's dividing into two parts, right and left pulmonary artery. You can see in this image, this is right and this is left, this portion is right, this is left portion. This is right ventricle, this is left ventricle. So ultimately right ventricle to aorta and left ventricle to pulmonary artery. Now the next image, this image you can see the flow is bidirectional across the pattern foramen oval. You see this is blue flow, that means flow from right atrium to left atrium. Red flow, it means flow from left atrium to right atrium. So flow is bidirectional across the pattern foramen oval. This child has only PFO for the mixing of the blood, because in this transposition the right sided chamber is separated from left sided chamber, because blood comes from IVC to right atrium, then it to right ventricle, then to aorta, then to whole venous system, again to right atrium. So ultimately whole circulation, systemic circulation comes to right side, and left atrium receiving blood from pulmonary artery, left atrium, then giving to left ventricle, and then giving to pulmonary artery, then it goes into pulmonary circulation, then through pulmonary vein comes into left atrium. So left atrium receiving blood from pulmonary veins. So ultimately right sided circulation, systemic circulation, and left sided circulation, pulmonary circulation, both circulation are separated. So there should be some sort of either ASD, BSD or PDA for the mixing of the blood for the survival. In this case only PFO is available, so case needs urgent surgical corrections, so the child will survive. Only thing I want to highlight in this case, this has got bidirectional flow. This is blue in color, this is red in color. Blue in color, red in color, blue in color, red in color, blue in color, red in color. You see bidirectional across PFO. This is right atrium and this is left atrium. So left atrium receives blood from pulmonary veins, gives to left ventricle, gives to pulmonary artery, then again pulmonary vein, then left atrium. So whole pulmonary circulation is limited to left side, and whole systemic circulation is limited to right side, and there should be mixing of the bloods for the survival either through AST, VST or PDA. In this case only pattern foramen oval is available for mixing of the blood. So child needs urgent surgical corrections. No PhD and no PDA was seen in detailed examination. Thank you.